Imagine going into the hospital for a minor procedure, but coming home with a life-changing infection. Well, tonight, Local 2 Investigates is tracking potentially deadly diseases inside Houston hospitals.
Investigator Bill Spencer discovered which area hospitals have the biggest problems and why you may not be getting the entire story.
They are tiny, they're hidden, and they're attacking patients inside Houston hospitals.
We're not talking about something that's going to go away.
Jim Brackeen went in for minor surgery to repair a torn Achilles tendon, but he left with a common hospital infection.
They had me 10 days go twice a day for infusions of heavy doses of antibiotics.
Then came 40 days in a hyperbaric chamber. 2 years later, the infection still hasn't gone away. In fact, he'll have to do this home treatment twice a day for the rest of his life.
It's a miracle that I'm walking at all.
Brackeen is just one of millions of patients to get a hospital-acquired infection. The CDC says 1 in 25 patients will get them, and as many as 77,000 people die each year.
And when you start looking at these numbers, you really start thinking that this is a public health issue.
Dr. Luis Ostrowski is the top infectious disease expert at UT Health Medical School. He says it's so serious, hospitals are changing disinfection procedures, like asking staff to wash their hands more often. The infection numbers are dropping, but Ostrowski says it's not enough.
We're so serious about it, we're going to monitor that you're doing this every day.
Now the state is letting you see the numbers. 2 years ago, Texas started publishing infection rates, hospital by hospital, tracking surgical site infections and infections for central lines used for seriously ill patients. In 2012, these 4 hospitals had high central line infection rates in their ICUs. 3 other hospitals had high infection rates for certain surgeries. The good news is, a year later, all of those hospitals had improved and were off the list. Last year, Harris Health's LBJ and Bentob hospitals were both named for high infections after hysterectomies and colon surgeries.
How serious did you take that information?
We were very concerned about this, which is why we jumped on it so quickly.
At Texas Children's Hospital, Dr. Jeffrey Stark says a high rate of infections actually affected the tiniest babies in the neonatal ICU. So the hospital created a fix-it team.
Within just a couple of months, we saw a decline in the infection rate in that unit, which has continued to this day.
It's bigger than just the numbers.
But patient advocate John James says you're not getting the full story. The database doesn't cover MRSA and other superbugs that are resistant to antibiotics. And James says there's little being done to publicize that any information is actually available to see.
The state health department does all this work with state tax dollars, and if it's not serving the public, what's the point?
All of our experts say you should report dirty hospital conditions or bad practices, like the staff not washing their hands. And before you go in for a procedure, ask your doctor about that specific hospital's infection rate. I'm Bill Spencer, KPRC, Local 2.